All right, good morning, everyone, and welcome to FWMD Live. The Islamic holy month of Ramadan actually began on April 2nd, and it will end on May 2nd. We also want to acknowledge that it is also National Arab American Heritage Month, and that has been observed during the month of April since 2017. So today we are going to be discussing how physicians can treat patients during Ramadan. We have a great group of panelists together for that discussion coming up. But before we get to that, we're going to start with me. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU School of Medicine. And joining us for our discussion is Dr. Imran Siddiqui, a professor of medical education here at the School of Medicine. Good afternoon, Dr. Siddiqui.
Good afternoon. Thank you for having me on this panel.
All right, thank you. We appreciate you joining us. I'm also happy to have Sana Chowdhry, a first-year medical student at the School of Medicine, joining us today. How are you doing, Sana?
I'm good. Thanks for having me.
All right. And last but not least, I am also happy to have Naimah Sarwar. She is another first-year medical student here at the School of Medicine. How are you doing, Naimah?
I'm doing pretty good. Thanks so much for having me today.
All right. So now, if you would like to be a part of this conversation, it is really simple. All you need to do is jump in the comments section and leave your questions for our guests, and then we will definitely get you some answers. But before we get to that, we are going to begin our discussion with Sana and Naimah. So the first thing I want you to do, Sana, can you explain what Ramadan is and why it is so meaningful?
Sure. So Ramadan is the 9th month of the lunar calendar, and it's the month that Muslims usually observe fasting from sunrise to sunset, amongst other things. It's a time for us to focus on our relationship with God and try to better ourselves spiritually. We try to do a lot of things, be generous, kind, and gracious as much as we can. For me personally, it's like a spiritual reset where I can kind of remove myself from things that distract me in the world. Really, it's an opportunity for me to push myself spiritually. So I really look forward to it each year to see how much I can grow.
And Naimah, can you just kind of elaborate a little bit on why Ramadan is so meaningful for you?
Yeah, for me, I think we have a lot of conversations these days about mindfulness, gratitude, and really being present. And I think I like to embody those things during Ramadan for myself, to be mindful spiritually, be grateful for what I have, and really just try and live in the present. And then in addition to all the inner work that we do, it's really important for us to give back to our community and just really be charitable with our thoughts and actions.
All right, that's great information. And we also have a link to share, ramadan.day, D-A-Y, and that will tell you all you need to know about Ramadan. So we're going to put that link in the comments section. Dr. Siddiqui, I want to bring you into this conversation as our faculty physician on the panel today. Can you talk a little bit about the importance of empathy and the compassionate practice training for our medical students? How can that help them make sure that they can connect with patients of all backgrounds in the future?
Sure. Yeah. Actually, the best healthcare practice requires proficiency in both scientific and humanistic aspects. Therefore, a physician must be focused on treating the whole person regardless of any background and not just their diseases or symptoms. And our school completely recognizes the humanistic aspect as well. Therefore, we have an innovative and interdisciplinary course which is called as compassionate practice. It is actually embedded and integrated throughout all phases. It does not come once in our medical program. It is integrated throughout all phases. And through this portion of the curriculum, our students learn authentic methods to listen and connect with patients of all backgrounds without any bias, and prepare them to be respectful and non-judgmental and be ready to apologize for cultural mistakes.
And you know, Dr. Siddiqui, what I'm going to do right now, we're going to put a link to the compassionate practice on the School of Medicine's website, so anybody that's watching can get more information about how the medical students are using how the medical students are actually learning to use theater techniques, also journalism techniques, and also narrative medicine and writing techniques as well, to be able to become better physicians in the future. So we're going to put that in the comments section. Sana and Naimah, you all are first-year medical students, so you just got to the School of Medicine a few months ago. Sana, can you tell me what were some of the reasons that you decided to choose the School of Medicine?
Sure. I think what initially drew me to the School of Medicine is how quickly we're immersed in clinical settings. I'm just a hands-on tactile learner, so I've always gravitated towards learning experiences where I can just see what I'm gonna experience like hands-on instead of like in a textbook. So that was the first thing that drew me in. And also in the past, one of the primary reasons I chose medicine is because of kind of bonding experiences that I've had with patients. And so I was looking forward to that and knew that it would motivate me through like the more difficult parts of the curriculum.
And Naimah, what were some of your reasons?
Yeah, I think for me, I was really surprised when I was researching the program and it aligned so well with the values that I see myself practicing within the future, with the compassionate practice really focusing on empathy and the doctor-patient relationship and the art of medicine. Like Sana said, the focus on being in clinic so early on, I think being able to learn in a clinical setting has been something that's really just grounded what we're learning in the classroom in reality for me. And then additionally, the learning communities, as physicians, we're going to be practicing in a community in the future. And I think engaging with that community from such an early age is really important.
And Sana, can I just ask you, with the compassionate practice training, some of the courses that you all have gone through already, how has that kind of helped you understand the importance of recognizing a patient's cultural identity and their background?
Oh, it's helped a lot. I think not just culture, but also like the patient experience, understanding from the patient's perspective, because of course, whenever we are faced with a patient, we see them for like 30 minutes to an hour max, but whatever they're dealing with, they're going to be with for the rest of their life, possibly. So it really helps to see it from that empathetic lens, kind of like the intersectionality of their illness and the culture, the religion, everything together, just to imagine it from where they're coming from, as opposed to just a patient that we're going to see for the next 30 minutes. It's been really enlightening.
And also, I want to talk a little bit about the COVID-19 pandemic. So, Naimah, how has the pandemic affected how you celebrate Ramadan?
Yeah, I think slowly we're moving a little bit more back to normal, but for the past 2 years, definitely there was a huge inability for us to, gather together as a community, which is something that can be really important for a lot of people. But I think it also has challenged us to kind of see how we're going to celebrate Ramadan, regardless of our ability to gather together and really focus on the values that are important to us. So my local community about 2 years ago started this program with the local food bank to basically address food insecurity. And so we did like a car drive-through for people who were struggling with food insecurity due to COVID. So I think really just finding ways to think outside the box when it comes to our values and how we can give back. We're a really generous community. And so we try to stay true to our values in the face of adversity.
Right. And Sana, have you kind of pivoted a little bit during the pandemic and found different ways to celebrate Ramadan as well?
Yeah, I agree with everything Naimah said. And also, like she mentioned, there's a big part of community that comes in during Ramadan. We're really encouraged to pray together, especially at night, and to just enjoy each other's company. When we break our fasts, like invite each other over and just like have your heart open and warm. And of course, because of COVID, a lot of that we had to step back from. But I think in a way, it was interesting to see how we could kind of make the most of our time independently. And also, of course, even though we couldn't kind of interact with neighbors and friends and stuff, we still had our own families. So it really maximized our bonding time with our immediate family. So I really was grateful for that.
Yeah, I like that, the idea of the family and community coming around during the Ramadan celebrations. I just want to let everybody know this is FWMD Live, and if you're just joining us, thank you. And also today we are talking about treating patients during Ramadan. We have guest panelists on for this discussion, and if you have any questions about Ramadan or treating patients during Ramadan, just put those questions in the comments, and then I will definitely get you some answers from our experts. Dr. Siddiqui, Sana just mentioned fasting. I want you to just kind of explain to us, what does it mean to fast from a clinical perspective?
From a clinical perspective, yeah. So fasting is not for losing weight or just a physical cleanse. It goes much deeper and is spiritually rooted. It is about recognizing and understanding hunger and awaken the feelings of compassion that we already talked about as a course in our medical program. Uh, Ramadan also teaches patience, self-control, and humility. And Ramadan, people take time to pray and practice self-reflection. So in general, Ramadan instills empathy in a Muslim to feel what the other feels. And it is a very important humanistic element of the treatment while we are dealing with our patients.
And Sana, I just want you to just share your thoughts on fasting as well. I know everyone may have a unique perspective on fasting, but how do you view it?
Yeah, I appreciate that you said that everybody has a unique perspective, because I think Ramadan is personal to everyone. It's a different journey for everybody. The common similarities, of course, that we avoid food, water, anything like that from sunrise to sunset, but it's less of a physical act and more of a spiritual internal thing where you're just trying to avoid any bad habits, avoid anything negative, and just bring out the best version of yourself. So really it's just seeing your own potential.
And Naimah, how important is fasting for you during Ramadan?
Yeah, I think when people hear about Ramadan, like fasting is the number one thing that they associate with it. And for me, that's kind of what is like the obvious thing about Ramadan that I do to start to practice. But at the same time, I think there's also like fasting in other aspects of your life too, especially in terms of like, you don't want to be lying, gossiping, stuff like that. So just really focusing on the positive, like Sana said. And I think, yeah, you highlighted a great point that it is a very personal thing. So it could differ from person to person, which I think we'll also get into a little bit.
And Dr. Siddiqui, just understanding that it varies from person to person, can you explain to us why it is important for others to just not assume that everyone who looks Muslim is fasting?
Yeah, this is important because the Quran, the holy book of Muslims, clearly teaches that those who are too sick, menstruating, nursing, pregnant, prepubertal children, elderly or traveling are exempted from fasting. And Muslims who are chronically ill, as you said, in whom fasting is unreasonable, are also exempted. Therefore, we should not assume if anyone you are seeing as a Muslim not fasting, it could be possible that they may have a medical reason for not fasting. So the healthcare provider can be the only person who can ask the question about it.
Yeah, and can you talk a little bit about that within the culture, the relationship between the medical provider and the patient? Why should that question only be brought up by the healthcare provider?
Yeah, so because no one knows like what is going behind in the health condition of the person. So it is like no one's spirituality should be checked. So it's like Naimah and Sana already mentioned, it is a personal thing. So no one in the family or the friends should ask about it. And when it comes to the health and disease management, obviously the doctor or a healthcare provider would be the best person to ask about it.
And Dr. Siddiqui, when you mentioned, patients that may have chronic medical conditions, is it wise that those patients seek advice from a physician if they decide they still want to fast?
The short answer is yes. They have to ask. Okay.
Right.
So patients who plan on fasting must receive structured, focused, fasting focus actually, education to help them avoid complications. A pre-fasting assessment of patients with chronic diseases such as diabetes is always recommended. And so they can be made aware of the risk and the strategies to avoid problems. As fasting in Ramadan can have an effect on Muslim patient disease management, therefore it is important for physicians and budding physicians like medical students to be culturally competent and knowledgeable about the basics of Ramadan, such as exemptions, what are the things exempted from fasting, treatments and procedures that invalidate fasting, and the effects of fasting on managing patients with chronic diseases, such as diabetes mellitus, cardiovascular, gastrointestinal, renal, and other common diseases. So again, I will bring back my short answer. Yes, it is must.
Yes, seek advice from a physician if you have chronic medical conditions, if you're thinking about fasting during Ramadan. Good advice from Dr. Siddiqui. I want to let everyone know this is FWMD Live. If you're just joining us today, our discussion is about treating patients during Ramadan. And so we have guest panelists that can answer any questions you have about treating patients during Ramadan or just about Ramadan in general. Just jump in the comments, leave your question for our guests, and then I will definitely ask those questions and get you some answers. So Sana, I want to come to you and talk about being in medical school. Medical school comes with a heavy workload, right? That's pretty common knowledge for a lot of people about attending medical school. So for yourself, how have you managed that workload while still celebrating and acknowledging Ramadan?
I will say it has not been easy. I think especially coming out of 2 COVID Ramadans where we kind of were making our own schedules being at home now that we're back in person, which I am grateful for as a student. It has been a little trickier. I think for me personally, balancing my academic and spiritual goals has been a little bit difficult. I feel like whenever I'm prioritizing one, I'm neglecting the other. So one thing that has consoled me is the fact that Islam weighs intentions very heavily. So every time I sit down to study, I just remind myself that I'm doing it for the sake of Allah or for God. That I'm doing it so that I can be a doctor, that I can help people and have like a positive impact on the people around me. And whenever I renew my intentions like that, it actually allows my time studying to be considered as time in worship. So that is kind of like a way for me to intersect the two of them, which has been really nice. And it minimizes like the guilt of not spending time like actively praying or reading Quran. And then the academic guilt is just kind of year round. So I'm used to that at this point.
And so Naimah, you know, our audience that watches FWMD Live is usually a lot of community members, but also lots of medical students and potential medical students. So can you just share some advice on how you've managed that workload and still been able to, you know, spend time connecting and recognizing your faith?
Yeah, I think Sana brought up some really good points about kind of grounding your studying in what goals you hope to accomplish with it. And ultimately that goal is to help other people. It's still a work in progress, I think, for both of us. We're still adjusting to it. But I think just being proactive, and our curriculum is pretty flexible as it is. It kind of gives you the space to create your own study schedule for the most part. So I think just going into Ramadan with, you know, knowing that we're going to be tired, especially in the afternoon. So maybe rescheduling some of our studying for the morning time or the late evening time has been really helpful. And yeah, I think a little bit of that academic guilt, like Sana was saying, is still there. You know, when it gets to 4 o'clock and you're a little bit behind on your pre-work, it's like, you know, how am I going to do this? But I think really, like I said, being proactive is really helpful and just knowing yourself and what works for you.
All right. And so Sana, I want to give you a quick shout out. So Claire Dukin just said, I love how you turn your work to worship. So that was she said that was well said. So thank you, Claire, for your comment. We appreciate it. We've been talking about the community aspect of Ramadan and worshiping with family and coming together. So another thing that the School of Medicine has is student interest groups. So those student interest groups can be of medical specialties. Those student interest groups are also set up by ethnicities, right? So people can have a community here at the School of Medicine. Sana, can you talk to us why it was important for you and Naimah to start the process of creating a Muslim student interest group here at the medical school?
Sure. So I'll let Naimah explain herself, but for me personally, I feel like I was just looking for a space for Muslim and minority students, and I wanted to create a SIG that was grounded in like the beautiful aspects of Islam rather than for Muslims to like actively practice Islam, if that makes sense. I wanted it to be grounded in things like charity and volunteering and some of the more the like foundational pillars of Islam, and so that everybody can kind of be drawn to it for like common interests. Because in medical students, there's no shortage of people looking for volunteering opportunities or just like to help people in general. So that's why I wanted to create a SIG, and I personally see a lot of overlap between the values in medicine and the values in Islam. So I thought there was room for a SIG that kind of overlapped in those two areas. And that's why our SIG is open to everybody. And we're just looking for people that have a passion for charity and for service and want to just do good things.
And I do want to point out with the student interest groups, for any medical students that are watching, the great thing about our student interest groups, especially the ones that are around ethnicities, is that all of the students can be a part of any student interest group. So you still get to see this wonderful opportunity of cultures merging, right? For different student interest groups. It's not just one specific ethnicity or race. So I think that's a beautiful thing about how the student interest groups work here at the School of Medicine. We did get a question. So the question is from Young Tran. Thank you for your question, Young. So the question is, if I don't know that a patient is Muslim and the patient doesn't tell me their plans regarding fasting, how do I encourage my Muslim patients to bring it up with me, especially since I may not see them the month before Ramadan to help them plan? And also, if I do know that a patient is Muslim, is it then okay for me to bring up the subject of Ramadan, or should I wait for them to bring it up? So Dr. Siddiqui, I think this is a question that maybe you can address.
Yeah, no, this is a great question. So obviously, if we don't know the faith of the Muslim, it would be hard to communicate in that way. But if we know, if the patient is a Muslim and he is not coming to you about the plan of fasting, then there is no harm in sending a happy Ramadan wish prior to the start of the Ramadan. So in this way, you can connect with the patient, and you can ask if you have a plan to fast. So you may need a pre-assessment and other things. If patient is having any chronic disease, so you can specifically talk about it in that communication. So communication is the key. And one thing, obviously, is the main thing, which sometimes is a misconcept, that you can't say Happy Ramadan or something like this. No, it's completely all right to send wishes for Ramadan. That will start the communication.
Right. All right. So start the communication. That's coming from Dr. Siddiqui. Dr. Siddiqui, I do have a question since we're talking about medical professionals working with patients. Can we talk about a different aspect for medical professionals? So how do they typically navigate Ramadan while still having to work night shifts or be on call at hospitals? What has your experience been?
I would say it is not hard, but it is different from the other days. So obviously, everyone who is fasting needs to do something to navigate Ramadan when on call or on shifts. So what they do usually, they communicate with their managers and co-workers about their upcoming fast. They give them a heads up about Ramadan, like what Ramadan is, what you will be doing, and how long it lasts. So it would allow the supervisors and co-workers to adjust their shifts and allow some time for them to break their fast or having the meal before starting the fast. And these physician or healthcare workers, they usually pack nutritious, high energy, ready to eat foods like dates. We usually break our fast by having a date. Protein shakes, protein bars, nuts, or deli meat sandwiches. So ready to go, because you never know what will happen on shift. And the best and the most important thing is to avoid dehydration by drinking ample amount of fluids between sunset and dawn, the hours where we don't fast.
And Dr. Siddiqui, since you brought that up, I just want you to give some advice to younger physicians that may be going into residency and they may be of Muslim faith, having that conversation. Should they be empowered and have that conversation with their managers at the hospital so they can have that understanding before, Ramadan arrives?
Yes. So that's why it's very important. Like do not assume that everyone knows what Ramadan is. So talk to them and tell them what Ramadan is, what happens during Ramadan. So two events are very important. For example, the meal before start the fast, which is called suhoor, and the time of the breaking the fast, the iftar, which is a time. And obviously, these practicing fasting, the people who are fasting or the resident who are fasting, actually, they need some time to offer prayers. So unless they speak to the managers, no one will know that what it needs to be to fast.
Right. All right, so that's good information. Thank you, Dr. Siddiqui. I just want to let everybody know watching, if you're just joining us, this is FWMD Live, and today we are talking about treating patients during Ramadan. We have a group of panelists. If you have a question, you can jump in the comments and leave that question, and I will get you some answers from our panelists. I also want to just put this out there because we're going to put a link in the comments section. Just recently, the inaugural American Muslim Medical Student Conference was introduced, and that conference allows medical students to present their research on a national scale. There is a deadline for filling out an abstract submission and registration form, which is May 25th, 2022, and we're going to put a link to that in the comments. So if you're a medical student and you have some research that you want to share, that could be a place to do that. So now with my guests, I want to get to a little bit of a fun part. I want to talk about the favorite part of Ramadan for you all. So Sana, can you just kind of tell me what is your favorite part of Ramadan?
Sure. I think for me, Ramadan is a very peaceful time because, as I mentioned previously, you're encouraged to like step back from the world and just focus on things that are more spiritual and less of the like everyday stressors and anxieties that we have. So for me, it's like a very grounding experience because I'm sure most people in medicine or in medical school understand that it's all about like getting to your short-term goals and just one after the other. But Ramadan just forces you to realize that's all temporary. And at the end of the day, what's happening now won't matter in a few years. So Ramadan is just a good way for me to focus on things that are more permanent, like my own beliefs and my own like actions. So yeah, and it also allows me time with my family and community, which are very important to me.
And Naimah, do you have a favorite part of Ramadan or a favorite memory from Ramadan that is close to you?
Yeah, I think like Sana said, a lot of it is the internal work that's really special and getting to focus on yourself. But there's just kind of this atmosphere and vibe that comes with the month of Ramadan, which is interesting because it moves along the calendar. It's not necessarily the same month of our calendar every year, but it's just like the atmosphere of friends, family, community, my mom's food, which I love. And yeah, so it's been interesting to kind of establish that atmosphere and the traditions for ourselves here, being away from family for the first time for the whole month. So that's been pretty cool and something I'm looking forward to.
I love that. Mom's food. That's always touches the soul, right? A meal from your mother. Oh, yeah. Dr. Siddiqui, can you share one of your favorite memories about celebrating Ramadan?
Memories are the best part probably because I have adult children, so they are busy in studies and one is on job.
Can you give us a little bit of both?
So yeah, so I really like the family aspect of Ramadan. Our whole family tries best to sit together for suhoor and iftar. So this is the best part, what I like about the Ramadan now. And obviously the spiritual part is very important. So cleansing of my heart and closeness to the creator of my creator is the best part that I like.
All right, that's special. I love that. All right, so that will do it for today's FWMD live chat. I want to thank everyone on Facebook for being a part of today's conversation. And also I want to give a special thanks to our guests, Dr. Siddiqui, Sana, and Naimah. I thank y'all for being a part of this panel and having this discussion. Thanks.
Thank you.
Thanks so much.
Thank you.
Once again, thank you everyone for watching. Thank you to our guests, and we will see you soon.